OraCare has been around for a little bit over 6 years, and because of its active ingredients, it's a very versatile product. It kills bacteria, viruses, fungi. It eliminates volatile sulfur compounds, and it breaks up biofilm. It's used for a lot of different things. There was a dentist that had placed implants on a patient, and when she came back in for a post-op, he's never seen tissue as healthy as hers, and he asked her what she was doing, and she was using OraCare every day. And so he contacted us and said, man, the tissue on the patients that use OraCare, he said, it's just amazing. He said, could you create a gel? And it happened to be at that time we were in the process of creating a gel. So we talked with him, and we added aloe vera to our rinse and came up with a system where gel can be used right after surgery, and then our implant rinse for the patient to take home to use for 30 to 34 days. And we've seen great results with it. Look, 10% of all dental implants fail. And the number one cause is peri-implantitis. I just don't think as dentists we realize what a catastrophe a failed dental implant is. I mean, it can cost you not only financially, but time. It takes over a year for a failed implant to be replaced. Even though you've done nothing wrong, it can cost you a reputation. The patient feels like you might have done something wrong. It can cost your confidence. Sometimes when you have a failure, you tend not to want to do that procedure anymore. So we feel our system can fight the number one cause of dental implant failure, and that's peri-implantitis. Unfortunately, I think most dentists do nothing. And really, it's kind of crazy because if you think about it, a lot of those patients are needing implants because they got poor home care. And a dental implant's a lot harder to take care of than a natural tooth. Like, you could be the best clinician and do the best job placing that implant, but if the patient doesn't take care of it, they're going to get gum disease around that implant, and that implant will fail. And that's where our system comes into play. Not only right after the surgery, but continuing throughout the lifespan of the implant. More. It's harder to take care of an implant than a natural tooth. Sure, they're not going to get a cavity, but you know, the number one failure is gum disease around the implant. And we're talking about a population where less than 20% actually floss daily. And the ones that do, don't do it properly. And it's harder to floss an implant than it is a natural tooth. So they need help. And that's where OraCare comes into play. It's simple. First, we'd like for you to pre-rinse with OraCare before the surgery, and we give you a free operatory bottle to do that with. Then, after the surgery, you place the gel for 3 minutes on the surgical site, and then you send the patient home with the rinse included in the package. They rinse 3 times a day for at least 34 days to make sure that the gingiva heals. And then eventually, I think we should move them to regular OraCare to help the life of the implant. Yes, it can be. We've had great success with that. You use it the same way as you do post-op surgery. You bring the patient in, clean around the gingiva, place the gel for 3 minutes, send them home with a rinse, and follow up every 2 weeks. You should see results immediately. I think the number one way is go to our website, oracareproducts.com. We have a study on there. We have pictures before and after. We have instructions. If you need more help, call the number there, and one of our customer services can help you. Well, thank you. We appreciate it. We're real excited about this product. We think that we can really help patients and doctors prevent the #1 cause of dental failures, peri-implantitis.